Hi, I'm Dr. Mark Poray, a sports and family chiropractor in Whitby, Ontario, and I've been in practice for over 27 years, during which time I've managed to look after many professional and high-performance amateur athletes, both in my office and at several Olympic and Pan Am Games. I'm currently the team doctor for the Brooklyn Redmen of the Major Series Lacrosse League and the team chiropractor for the Toronto Rock of the National Lacrosse League. Today, I want to touch on what many people consider a new therapeutic modality, and that is KINESIO tape. This tape has actually been around since the early 1980s, when it was invented by Dr. Kenzo Casey at the University of New Mexico, and has since evolved into a very popular, well-used therapy. No doubt you've seen this colorful tape on TV worn by many athletes, from divers to cyclists, from marathon runners to professional football players. What you may not realize is that KINESIO tape actually has more uses than just helping elite athletes. It can be used for mechanically correcting the pull of muscles by stimulating them positionally through the skin, or it can be used to correct the fascia or the connective tissue between muscles from not unwinding from their desired positions. Thirdly, KINESIO tape can be used for spatial correction. That is, to increase the space directly over an area of inflammation, swelling, or edema, and reducing the pressure by lifting the skin somewhat. So it acts in this manner. The fourth use is described as a ligament or tendon correction. It does this by acting the area of the ligament or tendon through mechanoreceptors in the tendons. These nerves are perceived by the body as stimuli, or proprioceptors, which stimulate more normal tissues. A fifth effect can be attained when we want to create a sensory stimulation to either assist or limit motion. In this case, by increasing mechanoreceptor stimulation, it acts to preload them during end of motion positions, and either helping them to continue with an assist, or by restricting them with a pull. The sixth effect is the removal of swelling caused by inflammation or bleeding by directing this exudate towards the nearest lymphatic ducts. It does this by creating areas of decreased pressure underneath the tape. And when you remove a web type of tape over a hematoma, you will notice that the blood is completely gone from the area underneath the tape. These days, a number of highly trained clinicians and therapists, there are a number of these clinicians and highly trained therapists who can apply KINESIO tape for one of these purposes. In order to accomplish this, the tape must be cut in a specific manner, placed in a specified direction, and applied with a designated amount of pressure or stretch. If it is not, then the pressure or the effect may be lost. It can also be applied in a series of different techniques over an area as the condition changes or improves. For example, we may move from edema reduction to pain control, to restriction of muscle function, or enhancement all over the same injury via several different tape cuts. Stretch, and pressure applications. Having said that, there are also pre-cut applications which can be purchased these days, and this is the Spider Tech form of the knee KINESIO tape. Once you have been instructed how to apply them, these are a great way of continuing the benefits of KINESIO taping without having to go to the clinic. The tape is flexible, it's durable and waterproof, and may be and after being applied, may be left in place for up to 4 to 5 days. This is one of the ways it differs from sports tape, which must be removed after each usage and shouldn't be left on for more than 12 hours. Another difference is that sports tape is generally used to limit motion of an injured area or a recovering joint, and in that way it protects the joint from motion and further injury. Sports taping should never be placed over swelling or areas of bleeding, while kinesio tape can be placed over muscles or joints newly injured to help the injury heal and then help the muscles and joints work more effectively as the function returns. If you're interested, there are several different manufacturers of kinesio tape. I personally use Spider Tech, but there are several different other types like kinesio tape, the brand name, rock tape, and so on. And you can get those in the rolls or as in pre-cut products for various different parts of the body. You should check with your personal therapist or your clinician to see which they recommend, and there are a number of very good videos on YouTube to which you can refer to see how it should be applied if you happen to forget. If you are interested, there are several manufacturers of kinesio tape in the form of rolls and pre-cut products. I'm Dr. Mark Poray, and I do both sports taping and kinesio taping in my office in Whitby at the Brooklyn Family Health Center at 4945 Baldwin Street South. Thank you very much for watching. You can get more information from my website at www.drporay.com, or you can call our office at 905-655-5767. Thanks again.